Welcome to The Explainer. Today, we're tackling a really serious medical emergency, acute decompensated heart failure. We're going to talk about what happens when the body's most important pump just starts to fail, suddenly.
So to really get a grip on this, let's use an analogy. Imagine your heart is the central pump for the entire plumbing system in your house. So what happens when that pump just breaks down? We're talking a full-blown system failure.
And look, this isn't some slow, gradual thing. We're talking about an acute crisis. It's a really sudden worsening of symptoms that's so severe, it pretty much always means a trip to the hospital right away to deal with some really life-threatening stuff.
And you know, the scale of this problem is just huge. Get this, acute decompensated heart failure is the #1 reason people over 65 end up in the hospital. The #1 reason.
And here's the kicker. It's a vicious cycle that is just so hard to break. A staggering 64% of patients who are sent home from the hospital are right back in there within just 3 months. That's a huge number. All right, Section 1, reading the body's clues. So when a patient shows up at the hospital, doctors basically have to become detectives. They're looking for all these critical clues the body is sending out.
Okay, so the first set of clues, they all point to something called congestion. Let's go back to our plumbing analogy. This is like the whole system is backing up. The pipes are clogged and fluid starts flooding the house. You see swelling, sudden weight gain, shortness of breath, especially when moving around. Doctors have a term for that. They call it DOE, or dyspnea on exertion. Now, the second set of clues points to something called hypoperfusion. If congestion is a flood, hypoperfusion is the opposite problem. The water pressure is dangerously low. Blood just isn't getting to the rest of the house. This leads to things like cold hands and feet, confusion, and then really serious stuff, like your kidneys starting to shut down.
Okay, Section 2, the 4-quadrant map. So this is where it gets really clever. Doctors take these two big sets of clues, the flooding and the low pressure, and they use them to plot the patient's condition on this really powerful diagnostic map.
And to keep it simple, they boil all these complex signs down to 2 easy-to-understand states. They call it wet, when the system is flooded with congestion, and cold, when the system has that low pressure from poor perfusion. Wet and cold. Simple, right?
And this is where the magic happens. By combining these two factors, you get 4 distinct profiles. It's like a grid. Are you wet or dry? Are you warm or cold? Answering those questions helps doctors pinpoint exactly what's going on.
And here it is. It's called the Forrester classification. It's this brilliant 4-quadrant map that gives doctors an instant snapshot. They measure pressure inside the heart, that's the PCWP you see there, to figure out if the patient is wet or dry. Then they check the heart's pumping efficiency, the cardiac index, or CI, to see if they're warm or cold, and boom, they know exactly what they're dealing with.
So, where do most people land on this map? Well, by far, it's the warm and wet box. We're talking over 70% of all patients. So what does that mean? It means they're congested, that's the wet part, but their circulation is still okay, which makes them warm.
All right, Section 3, targeting the problem. So now that we have the map, let's check out the playbook. How does knowing which box a patient is in dictate the exact treatment plan?
Well, doctors have a core toolkit with basically 3 types of drugs. You've got diuretics, which are like a sump pump to get rid of all that extra fluid. Then there are vasodilators, which relax the pipes to lower the pressure. And finally, inotropes, which are used to just boost the heart's raw pumping power. Each one fixes a very specific part of the plumbing problem.
Okay, so let's go back to that super common warm and wet patient. The plan here is pretty straightforward. You gotta drain the flood. The main tool for the job is IV diuretics. You can think of them as these superpower water pills that just get all that excess fluid out of the system.
But the story is totally different for the most critical patients. These are the folks who land in that cold and wet box. This is bad news. They're both flooded and their pump pressure is failing. This is the profile that has the absolute worst prognosis.
So with these patients, you can't just start draining the fluid. That would be a disaster, actually. The plan has to be a 2-pronged attack. Step 1, you have to use inotropes to boost the pump's power and get the pressure back up. And only then, once the system is a little more stable, can doctors safely bring in the diuretics to start clearing the flood.
Okay, Section 4, the road to stability. Look, getting the patient stable in the hospital, that's huge, but it's really just the first step on what's going to be a much, much longer journey. You can really think about the treatment in two phases. In the short term, the goal is just survival, right? Improve the symptoms, stop any organ damage. But the long-term goal is every bit as important. You have to create a plan to stop this from ever happening again.
And the key to that long-term success? It comes down to a specific cocktail of oral medications called guideline-directed medical therapy, or GDMT. And it's not just one pill. It's a whole personalized regimen of drugs that are proven to make the heart stronger over time. The official guidelines couldn't be clearer. This therapy has to be continued and fine-tuned to give patients the best possible chance.
Which, of course, brings us to the final and maybe most critical question of all. After everything that happens in the hospital, is this life-saving long-term plan actually being followed once the patient goes home?
And this is where it gets really sobering. The data shows a massive gap. Even with these crystal clear guidelines, most patients go home on doses that aren't quite right for them. And then no changes are made to their meds for the next year. This leaves them totally vulnerable and, it just sets the stage for the whole cycle to start all over again. The system fails. Again.